Hi, I'm Ryan Horner, owner of Fast Track Physical Therapy, and today I want to talk with you about hip pain and the common causes of it. So first is bursitis. So bursa is a fluid-filled sac. We have many bursas throughout our body, and typically we'll find a bursa sac where a tendon is attaching onto the bone, or where a tendon or a muscle is going to be going over bony prominence. So that bursa basically helps to decrease shearing forces so that tissue doesn't become inflamed. Problem is sometimes the bursa becomes inflamed and that causes pain. So with bursitis, what are some of the symptoms? Besides having pain just to the side of your hip, oftentimes patients will complain about it hurts to sleep on their side at night. They lay there for an hour or two and they're waking up throughout the night because they have to turn over because the side of their hip hurts. Oftentimes I also hear patients say, yeah, if I've been sitting for 2 or 3 hours and I get up, those first 10, 15 steps are painful, and then it starts to kind of calm down and gets feeling better. But then the more I walk, then the more it hurts. Where does that happen at the hip? Typically it's going to be the outer aspect of the hip. Oftentimes I have patients come in, and especially my older patients, they'll say, I doubt there's anything you can do for me because I'm sure I got arthritis, and they'll point to the side of their hip. That is not arthritis. Arthritis is basically, it's osteoarthritis is the breaking down over time of the hip joint. So the nice smooth cartilage that you had when we were younger has now become more roughened and jagged and becomes painful. So rheumatoid arthritis can also do that as well. Simple x-ray will be able to diagnose that. So simple x-ray by your doctor will be able to tell if it's arthritis, and typically it will show the severity of the arthritis. And then that helps us to develop a game plan of how to treat it. Third thing is labral tear. The labrum, we have a labrum in our shoulder, and then we also have a labrum in our hip. I oftentimes look at the labrum as kind of like a gasket. The gasket kind of seals down over the ball and helps keep that ball up into the socket. So trauma, sporting injuries, falls, sometimes if you got a spur close to the labrum that's kind of beaten up onto the labrum, that spur can cause it to tear. So there's various things, reasons why you can get a torn labrum. And then the other issue that can cause pain is muscular pain or muscle tendinous types of pain. So whether that be, again, a tendonitis, maybe potentially even tore a tendon, we've seen that. Muscles are in spasm or just knotted up. You can hardly touch your buttock muscle because it hurts. Maybe you've been told you had piriformis syndrome, and that's the cause of the radiating pain going down your leg. Any of those types of things we deal with very effectively. If you're dealing with any of these types of symptoms, give us a call. Look us up on our website. We treat patients for an hour. You do not need a referral to come see us, so give us a call.